Finally, this does not apply to children who are too young to be vaccinated, now just up to age 11, or the schools they attend and the teachers and staff they interact with.
Since regulations are changing and more people can be inside without distancing 6 feet, specifically those fully vaccinated, why not open all schools to full in-person now? Why wait till September?
Well, again, they are open. As far as I'm concerned, there's nothing from the state perspective that would preclude them from reopening. It's all done on the local level. But I'd ask Secretary French to add to that.
Yeah, hi. I think, as Dr. Levine mentioned, schools are not covered by the CDC announcement. And, basically we still have a large number of people in the school buildings, namely the students themselves, that are not vaccinated. So we have to keep that at the forefront of our planning as we're thinking about the future.
Dr. Levine, have you heard any whispers or anything from other health officials about potential mask guidelines for schools since this initial announcement did not include them?
Well, the initial announcement was very specific to say that they were not included. So I think that's probably what we have at this point in time. I'm not hearing murmurings that that's going to evolve into something different.
Thank you.
Sure.
And lastly, I think in record time, Andrew McGregor, Caledonian Record.
Don't ruin this now. Andrew could go on for the next 45 minutes.
Yes, thank you. Good afternoon. This is for Dr. Levine. I know Dr. French and you just alluded to this a bit earlier, but I received an email a few minutes ago from a school nurse here in the Kingdom that's listening to this conference and is hoping that you can give a clear and specific statement on the ongoing mask requirements in schools for the remainder of the year.
Yeah, Dr. Levine.
Yes, I can give that clear statement. Students, staff, teachers, no change in anything. Continue to wear masks.
I strongly encourage parents to have their children vaccinated. It is important for all Vermonters to get vaccinated to ensure the safety of our communities and our schools. Understandably, parents will have questions about getting their children vaccinated. They should consult their local pediatrician and healthcare provider as necessary to get that information and advice. I want to thank our pediatrician and healthcare provider community for their support in this very important initiative. I also want to thank our school nurses for their leadership in this effort. Their work has been outstanding throughout this pandemic. The role of the school nurse is a very complex one, and our Vermont school nurses are a tremendously talented group who deserve our gratitude and appreciation.